You're the one that people count on, the helper, the healer, the strong one, right? But lately, you feel emotionally drained, exhausted, and maybe even numb. If that sounds familiar, you could be experiencing compassion fatigue. And it's more common than you think. Today, we're breaking the silence, unpacking the signs, and most importantly, showing you how to start healing. Compassion fatigue involves emotional and physical exhaustion that can affect people who have been exposed to other people's traumas and stressors. It's characterized by a decreased ability to empathize, feelings of helplessness and burnout due to the demands and supporting those who are suffering. It is also sometimes referred to as secondary or vicarious trauma. The ability to feel compassion and empathy for others is essential for prosocial behaviors and positive interpersonal relationships. Authentic compassion, as opposed to being polite and nice, is a complex neuropsychological process that is related to frontal lobe executive functioning. The most recently developed and most complex of cognitive processes. To engage in compassion, you have to be cognitively present. Understand one's social surroundings and be aware of one's impact on others. For people who support those who are suffering, such as those who work in the helping professions, continual exposure to other people's trauma can take a toll, making people feel that their well of compassion has been drained dry. Even when people want to empathize, they may find that they simply don't have the emotional and physical resources to do so. People who work in healthcare settings are often more susceptible, including nurses, doctors, first responders, home health aides, therapists, social workers, and other helping professionals such as behaviorists. It can also affect caregivers who are responsible for day-to-day care of a loved one with a medical or mental health condition. So let's take a look at what the signs are of compassion fatigue. While it's common for individuals working in professions that involve healing others to experience compassion fatigue, it can happen to anyone, especially if you're a family member, friend, or coworker. Everyone turns to for guidance and support. Even behavioral health professionals like myself, who are trained to take on trauma and suffering of others, experience it. Compassion fatigue can affect people differently, but a few common signs can include feelings of emotional, physical, and psychological exhaustion, feelings detached, cynical, or apathetic, excessive rumination and worrying about other people's suffering, blaming yourself or others for not doing enough to help or prevent a trauma, irritability or anger, emotional numbness, feelings of sadness, feelings of helplessness, difficulty sleeping, changes in appetite, stomach upset, nausea, even dizziness. Also, changes in your worldview or spiritual beliefs. And struggling to empathize with people who are suffering. People with compassion fatigue often find themselves feeling increasingly pessimistic. They may question their beliefs and question whether there is any good in the world. In the workplace, they may feel unappreciated, lose confidence and interest, and struggle to feel compassion towards people in their care. Compassion fatigue tends to happen gradually over time. It's important to remember that this is a progressive and cumulative process, and that compassion fatigue is the end stage. There are four primary stages of compassion fatigue. Number one, it's empathetic ability. This involves the ability of the individual to notice other people's pain. This ability is a keystone of the helping professions, which then exposes people to the emotional cost of caring. As part of this aspect of compassion fatigue, people must also experience empathetic concern, which involves a desire to relieve other people's pain and suffering. Number two is empathetic response. As a result of exposure to a person experiencing pain, people then have an empathetic response. In this stage, they engage in actions to understand the person and explore ways to help them. Number three, compassion stress. At this point, people may begin to experience residual compassion stress, particularly if they are helping someone who has ongoing trauma. Number four, compassion fatigue. Unless a person is able to sufficiently manage their compassion stress, their risk of developing compassion fatigue increases. The risk of reaching this stage is greater if a person is exposed to the secondary trauma for a prolonged period of time, or if they begin to have traumatic recollections of past traumas. People may also experience significant life disruptions, including increased illnesses, changes in lifestyle, problems managing personal or professional responsibilities, and feelings of anxiety and or depression. All of these things make it more likely that the individual will develop compassion fatigue. So, what are the causes of compassion fatigue? Compassion fatigue is caused by prolonged exposure to secondary trauma. People may be more likely to experience it if they also feel like they lack control of the situation or have a sense of helplessness. One of the key elements behind compassion fatigue is the constant demand for empathy. While empathy is essential in the helping professions, it can become emotionally exhausting when the demand for empathy is persistent and excessive. Compassion is a meta-cognitive process, thinking about one's own thinking. It's one of the highest forms of cognition, in my opinion. And you can't live there. It would be cognitively exhausting. When people engage in too much authentic compassion, fatigue sets in. People who work in helping professions, such as nurses, therapists, behaviorists, they all rely on empathy to help them connect with others. This allows them to take the other person's perspective, understand their pain, and respond to their needs in ways that can relieve suffering. There are also factors that can increase a person's risk of developing compassion fatigue in such situations. These can include high stress levels, poor coping skills, lack of social support, insufficient self-care, and a history of trauma. Working in a setting that involves constant exposure to trauma, such as emergency services or social work, increases a person's risk of experiencing compassion fatigue. Research has found that among helping professionals, the prevalence of compassion fatigue ranges from 7.3% to 40%. So, what's the difference between burnout and compassion fatigue? While compassion fatigue and burnout share some similarities, there are important distinctions between the two. Burnout refers to a state of exhaustion that causes poor motivation and a lack of interest in work. On the other hand, compassion fatigue is a specific type of burnout that refers to the negative emotions and loss of empathy people experience after being exposed to other people's trauma, pain, and suffering. Compassion fatigue occurs predominantly in people who work in helping professions and pops up the most for those in direct patient care. Having patients who rely on them can be a heavy weight to carry at times, especially when they don't prioritize their own well-being. Unfortunately, such feelings can spill over into an individual's life outside of work and lead to other problems. People who experience compassion fatigue experience burnout that contributes to feelings of helplessness and hopelessness. They may also become cynical about their work and feel that nothing that they do will have a positive impact on relieving other people's pain. What distinguishes compassion fatigue from burnout is the source of these feelings. Compassion fatigue stems from exposure to vicarious trauma, while burnout is caused by excessive work-related stress and occupational exhaustion. Burnout can happen to anyone in any profession and is usually confined to work duties only. People experiencing burnout can feel a sense of dread at work, procrastination, negative interactions with coworkers or clients, and other symptoms. However, these symptoms usually subside when not at work. Burnout tends to build slowly over time, caused by occupational stress and overwork. Burnout creates dissatisfaction, and it's linked to excessive pressure. Burnout can lead to a loss of motivation, energy, and interest. Now, compassion fatigue may occur suddenly, and it's caused by caring for people who are suffering. It creates life dissatisfaction. It happens when people feel helpless or maybe even out of control. It leads to a lack of empathy and PTSD type symptoms. So, how does one overcome compassion fatigue? If you recognize the signs of compassion fatigue, it's important to take steps to address it before it begins to take a further toll on your emotional well-being. Compassion is supposed to be a positive action. If it feels like work, it is probably too much. It indicates that it's time for a break or to engage in more manageable acts of compassion. In the short term, relieving feelings of compassion fatigue may involve taking a break from the source of the stress that's causing the problem. Taking time away from work is one approach that may help, But for many, it might involve temporarily reducing their workload, seeing fewer patients or clients, or working on a different area of patient care. The ability to reduce exposure can vary depending on a person's job. However, a therapist might be able to reduce their client load while a nurse might opt to switch to working in a different area for a period of time. An emergency room doctor or maybe an EMT, on the other hand, typically has less control over patients and situations they deal with in the workplace. In such cases, it is important to find other ways to cope with compassion stress. Now, here are some ideas on creating emotional boundaries. The first step is to set boundaries. Recognize and accept what you can't control and focus on what you can control. For many people who are in helping professions or who are caregivers, saying no to someone in need can be a challenge. For example, a therapist might agree to arrange sessions during off hours that interfere with their personal life. Creating specific rules for sessions, services, and hours can help. Practice self-care. If you feel yourself starting to experience symptoms of burnout or compassion fatigue, it's okay to take a step back and do what you need to do to support your own mental and physical needs. You can take steps to maintain a healthy work-life balance. Engaging in hobbies that brings you joy. Eating a healthy diet. Getting enough exercise and sticking to a daily routine. Preventing and overcoming compassion fatigue comes down to self-care. Your physical, emotional, and psychological well-being must be in check before you can help others. Compassion fatigue can be a risk for people who work in helping professions, particularly if they are exposed to high levels of secondary trauma. Compassion is your strength, but it shouldn't come at the cost of your well-being. Remember, you can't pour from an empty cup. If this video spoke to you, please give it a thumbs up. If you recognize the signs of compassion fatigue, it's so important to take steps to take care of yourself. Self-help strategies can be very effective, but it is also important to reach out for help if you need additional help and support. Seek professional help if you're finding it difficult to pull yourself out of the situation, especially if you are showing signs of depression, anxiety, or overwhelming stress. Common below if this resonated with you. I read every message. Like this video and subscribe for more mental health tools to protect your energy. Ask yourself, have I been caring for myself as much as I care for others? If not, maybe today is a good day to start. Thank you.